Rehab for a knee, you will want to work on your range of motion. So in a sitting position, you can bend your knee and use your hands to help increase your flexion in the knee. Your body can get in the way, so you can always lay down and use a jump rope, a towel, or a dog leash, which you can wrap around your foot. Then using your arms, gently pull your heel toward your butt, increasing your range of motion in your knee. It is important to keep your range of motion in your knee as much as possible. From there, you can switch over to your strengthening, which is a long arc quad with the toe slightly turned outward for external rotation. This works your VMO, and you want to use the last 30 degrees of knee extension. Stretching the back of the knee to make sure you have full extension, you can sit in a chair with another chair at equal height and put a weight on top of your leg to work on range of motion for your extension. For another strengthening in extension is to lift your leg up and over an object with the foot slightly turned out for external rotation. Finally, your hips can be weak, so working on hip abduction and standing is good. You want to make sure that the toe is behind the other foot when you do this so that you can hit the correct abductors. You do not want to turn your toe outward. This makes the muscle in the front of the leg, your quads, start working. You also do not want to have your feet side by side because, again, you are not hitting the abductors that you need. Finally, you do not want to extend or hyperextend that standing leg. You want to have a slight bend in it to make sure it's straight. Do not lean over when you do this exercise. This takes away from the hip strengthening that you are trying to accomplish. You also don't need to kick out very far, just as far as your hip.